Today's episode is about one of the most sensitive and important questions in parenting, schooling, public health, and modern society. Should schools teach sex education? And if yes, what exactly should children learn? At what age? Should boys and girls learn together? Should some sessions be separate? Does sex education protect children? Or does it encourage early sexual behavior? Does it help prevent sexually transmitted infections? Does it reduce unwanted pregnancy? Does it improve future relationships and marriage? What role should teachers play? And how can schools teach this subject without vulgarity, shame, fear, or cultural disrespect? Today's episode is called, Should Schools Teach Sex Education? The Truth Parents Need to Hear. Let us begin with a simple truth. Children are already receiving sex education. The only question is, from where? From trained teachers? From parents? From doctors? From reliable health education? Or from the internet? From pornography? From social media? From friends who are also confused? From jokes? From rumors? From fear? From silence? When adults refuse to educate children, the world educates them anyway. And the world does not always educate gently. It may teach them through misinformation, through shame, through pressure, through unrealistic images, through online exploitation, through peer myths, through fear, through silence. So the real question is not, should children learn about sexuality? They already will. The real question is, will they learn in a safe, age-appropriate, respectful, medically accurate way? That is the purpose of good sex education. Now, when people hear the term sex education, many become uncomfortable. Some imagine teachers giving explicit information to young children. Some fear that sex education will make teenagers curious and promiscuous. Some worry that it will conflict with family, religion, or culture. Some parents say, "This is my responsibility, not the school's." These concerns are understandable, but good sex education is not about encouraging children to become sexually active. Good sex education is about protection, responsibility, health, dignity, boundaries, respect, consent, emotional maturity, and future relationships. It is not about pushing children toward adult behavior. It is about helping them understand their bodies, protect themselves, respect others, and make safer decisions when they grow older. The best sex education is not vulgar. It is not sensational. It is not graphic. It is not shame-based. It is not ideology forced on families. It is age-appropriate health education. Now, let us define it properly. Comprehensive sexuality education means teaching children and adolescents about the physical, emotional, social, ethical, and relational aspects of human development. That includes body awareness, puberty, personal boundaries, consent, respect, healthy friendships, gender, respect, emotional regulation, safe and unsafe touch, privacy, online safety, reproductive, health, menstruation, nocturnal emissions, body, changes, pregnancy prevention, sexually transmitted infection prevention, contraception, decision-making, communication, pressure and refusal skills, respectful relationships, marriage, readiness, family responsibility, and the ability to seek help when something is wrong. Notice something important. This is not only about sexual activity, it is about growing up safely. It is about future relationships. It is about health. It is about self-respect. It is about protecting children from ignorance, abuse, pressure, and fear. Now, what is the best part of sex education? The best part is not simply teaching biology. Biology matters, but biology is not enough. The best part is teaching a young person, my body belongs to me. I have the right to say no. I must respect another person's no. Pressure is not love. Consent matters. Private parts are private. Shame should not stop me from asking for help. Puberty is normal. Periods are normal. Body changes are normal. Sexual feelings may appear during adolescence, but feelings do not have to control behavior. Relationships require respect, responsibility, and emotional maturity. Pregnancy and infections are real risks. Protection and responsibility matter. Love is not manipulation. Desire is not entitlement. That which is private should remain private. Online behavior can have long-term consequences. This is powerful education. It protects children, it protects boys, it protects girls, it protects future marriages, it protects families, it protects society. Now, let us discuss age. Sex education should not be the same for a 5-year-old and a 16-year-old. This is where many people misunderstand the topic. Age-appropriate education means giving the right information at the right developmental stage. For younger children, the focus should be basic body safety, correct names for body parts, privacy, safe and unsafe touch, who can help, how to say no, how to tell a trusted adult, respect for personal space, understanding that nobody should force them into uncomfortable contact. This is not sexualizing children. This is protecting children. For children before puberty, the focus should expand slightly. Body changes, hygiene, respect for boys and girls, no teasing about bodies, early understanding of puberty, online safety, personal boundaries, friendship, emotional expression. For early adolescence, the focus should include puberty in more detail. Menstruation, voice changes, body hair, growth, mood changes, attraction, privacy, body image, peer pressure, respectful communication, consent, digital safety, harassment, what to do if someone pressures them. This stage is important because many young people enter puberty before they emotionally understand what is happening. Without education, they may feel shame, fear, confusion, or embarrassment. For older adolescents, education must become more practical and responsible. Relationships, consent, contraception, pregnancy prevention, STI prevention, health services, communication, breakups, emotional pressure, boundaries, alcohol and decision-making, online, images and privacy, coercion, respect, marriage and long-term partnership, personal values, responsibility. This is not about telling teenagers to be sexually active. It is about recognizing that some will face pressure, relationships, curiosity, and decisions. Education gives them the tools to delay, refuse, protect, communicate, and seek help. Now, should boys and girls be taught together or separately? The answer is both. Some topics should be coeducational. Boys and girls should learn together about respect, consent, boundaries, communication, healthy relationships, online safety, gender respect, and shared responsibility. Why? Because relationships involve both. Boys must understand what girls experience. Girls must understand what boys experience. Both must learn respect. Both must learn that consent is mutual. Both must learn that pregnancy prevention is not only a woman's responsibility. Both must learn that emotional responsibility belongs to both partners. Separate education can sometimes reinforce mystery and shame, but coeducation helps normalize respect. However, some sessions may be better taught separately. For example, menstruation discussions may be easier first in a girls' group. Nocturnal emissions and male puberty concerns may be easier first in a boys' group. Question and answer sessions may be more honest when students feel less embarrassed. Body-specific health topics may need privacy. So the best model is combined. Co-ed sessions for shared values, consent, respect, relationships, safety, and responsibility. Separate sessions for sensitive, body-specific topics and private questions. Then bring the shared learning back together so boys and girls do not grow up ignorant about each other. Because ignorance creates shame, and shame creates cruelty. A boy who understands menstruation is less likely to mock a girl. A girl who understands male puberty is less likely to shame a boy. Both should learn that body changes are normal. Now, does sex education promote promiscuity? This is one of the biggest fears. But research has repeatedly shown that good sex education does not increase sexual activity. In many cases, it delays sexual initiation, reduces risky behavior, and increases safer choices when young people eventually become sexually active. Why? Because education reduces curiosity driven by ignorance. Education increases self-control. Education gives language for refusal. Education teaches consequences. Education reduces myths. Education makes risks real. Education makes responsibility visible. Silence does not create morality. Silence creates ignorance. And ignorance is not protection. If a teenager does not know how pregnancy happens, they are not more innocent, they are more vulnerable. If a teenager does not understand consent, they are not more pure. They are more likely to harm or be harmed. If a teenager does not understand STIs, they are not safer. They are more exposed. If a teenager does not understand contraception, they are not more moral. They are less prepared if they face real-life pressure. Good sex education does not say, go and do whatever you want. Good sex education says, understand your body, respect yourself, respect others, delay if you are not ready. Do not pressure anyone. Know the consequences. Make responsible choices. Ask for help when needed. That is not promiscuity. That is maturity. Now, how important is sex education for preventing unwanted pregnancy? Very important. Unwanted teenage pregnancy can affect education, family stability, poverty, mental health, future employment, and social well-being. A pregnancy is not only a biological event, it is a life event. It affects the young mother, the young father, the child, the grandparents, the school, the healthcare system, the economy, and the future. Sex education helps young people understand that pregnancy prevention requires responsibility, knowledge, timing, communication, and access to proper health information. It also teaches that pregnancy is not only the girl's responsibility, boys must understand responsibility too. A society that teaches girls to be careful but teaches boys, nothing creates injustice. Both need education. Now, how important is sex education for preventing sexually transmitted infections? Extremely important. Many infections spread because people do not know the risks, do not recognize symptoms, do not know how protection works, feel too ashamed to seek testing, or believe myths. Education helps young people understand. Some infections can have no symptoms. Protection matters. Medical testing matters. Treatment matters. Shame should not prevent health care. Partners must communicate honestly. Risk is not about how someone looks. Health responsibility is part of relationship responsibility. This is public health, not moral corruption. A society that teaches young people about disease prevention is not promoting disease, it is preventing it. Now, how important is contraception education? Contraception education is important because it gives factual knowledge, but it should be taught responsibly, not as permission for impulsive behavior, not as a replacement for values, not as the only message. It should be taught together with delay, consent, readiness, emotional maturity, mutual respect, disease prevention, pregnancy prevention, personal values, family responsibility, medical guidance. Contraception education tells young people, protection exists, but it must be understood properly. It also teaches that no method should be treated casually, and that health decisions should involve accurate medical guidance. Now, how important is sex education for future relationships and marriage? Very important. Because many adult relationship problems begin with poor education. People enter marriage without understanding consent, without communication skills, without emotional vocabulary, without respect for boundaries, without understanding desire, without understanding body differences, without knowing how stress affects intimacy, without knowing how shame damages closeness, without knowing how to talk about health concerns, without knowing how to ask for help. Many marriages suffer not because people are bad, but because they were never taught how to speak about intimate matters with dignity. Sex education, when done well, is also relationship education. It teaches respect, responsibility, listening, boundaries, self-control, shared decision-making, privacy, communication, care, health, emotional safety. These are not only school topics, these are marriage skills. A boy who learns respect becomes a better partner. A girl who learns self-worth becomes a stronger partner. A student who learns communication becomes a better spouse. A person who understands health becomes a more responsible adult. Now, what should not be part of school sex education? It should not be explicit demonstration. It should not be vulgar. It should not shame students. It should not mock religious or cultural values. It should not promote risky behavior. It should not be taught by untrained teachers. It should not be one dramatic lecture. It should not be fear-based only. It should not focus only on disease and pregnancy. It should not ignore boys. It should not blame girls. It should not treat curiosity as sin. It should not treat ignorance as innocence. It should not expose children to material beyond their age. The quality matters. Bad sex education can create confusion. Good sex education creates clarity. Now, what should a strong school program include? First, age-appropriate curriculum. Not everything at once. Second, medically accurate information. No myths, no fear stories, no fake science. Third, cultural sensitivity. Schools should respect family and community values while still protecting health and safety. Fourth, consent and boundaries. This is essential. Fifth, puberty education. Children should not be shocked by their own bodies. Sixth, STI and pregnancy prevention for older students. Seventh, digital safety. This is now critical. Children need to understand online privacy, image sharing risks, grooming, harassment, and permanent digital footprints. Eighth, gender respect. No body shaming, no period shaming, no masculinity pressure, no blaming victims. Ninth, emotional relationship skills. How to communicate, how to say no, how to accept no, how to handle rejection, how to recognize pressure, how to seek help. 10th, access to trusted adults. Students should know where to go if they are confused, harmed, pressured, or worried. Now, what is the role of teachers? Teachers play a very important role, but they must be trained. A good teacher is not there to embarrass students, not to share personal opinions, not to moralize aggressively, not to make jokes, not to shame, not to answer beyond the age level. A good teacher creates safety. They use correct language. They protect privacy. They answer respectfully. They know when to refer to a counselor, nurse, doctor, or parent. They understand child protection rules. They do not turn the classroom into gossip. They do not humiliate students. They know how to handle anonymous questions. They know how to teach boys and girls with dignity. The teacher's tone is everything. If the teacher is awkward, students laugh. If the teacher is judgmental, students hide. If the teacher is vulgar, students lose respect. If the teacher is calm, factual, and respectful, students listen. Now, what is the role of parents? Parents cannot outsource everything to school. School can provide structure, but parents provide values. Children need both. Parents should say, "You can ask me questions. If something worries you, tell me. Your body deserves respect. No one should pressure you. You must respect others. Your choices have consequences. Health matters. Your dignity matters. The best system is partnership. School gives science and safety. Parents give values and personal guidance. Healthcare professionals give medical accuracy. Together, children are protected. Now, should religion and culture be included? This depends on the school system, but values should be acknowledged respectfully. Many families want children to learn modesty, self-control, marriage values, faith, responsibility, and respect. Good sex education does not need to attack these values. In fact, responsible sex education can support them. It can teach delay, self-respect, consequences, family responsibility, emotional maturity. Faith-sensitive programs can still include medically accurate information. The danger is when culture becomes silence. Silence does not protect tradition. Silence often protects abuse, misinformation, and fear. A mature society can teach both values and facts. Now, let us talk about boys specifically. Boys need sex education because boys are often given the most dangerous misinformation. They may learn from pornography, from older boys, from jokes, from locker room myths, from online influencers. They may learn that masculinity means conquest, that pressure is normal, that emotions are weakness, that girls are responsible for pregnancy, that consent is unnecessary if there is attraction, that rejection is humiliation, that sexual behavior proves manhood. This is harmful. Boys need to learn respect, consent, self-control, emotional regulation, pregnancy responsibility, STI prevention, digital responsibility. No means no. Silence does not mean yes. Pressure is not romance. A real man does not exploit vulnerability. A strong man protects dignity. This education creates better men, better partners, better husbands, better fathers, better citizens. Now, let us talk about girls specifically. Girls need sex education because girls are often taught shame but not safety. They may be told, "Be careful," but not taught how to recognize pressure. They may be told, "Protect your reputation," but not taught how to protect their body. They may be told, "Do not talk about these things," but then they are left alone with fear, confusion, menstruation, harassment, online pressure, and unwanted attention. Girls need to learn. Their body is not shameful. Periods are normal. They can say no. They can ask for help. They are not responsible for managing boys' behavior. Their worth is not based on purity, myths, or appearance. They deserve respect. They deserve safety. They deserve health information. They must also respect others' boundaries. Sex education should not make girls fearful. It should make them informed, confident, and protected. Now, what about mixed-gender classrooms? A co-ed school should not pretend boys and girls live in separate worlds. They interact, they become friends, they date, they may marry, they work together, they must understand each other. So shared education is essential, but dignity matters. Some questions are private, some discussions are sensitive. Some students may feel embarrassed. That is why schools can use a mixed model. Co-ed for universal values. Separate for body-specific questions. Anonymous question boxes for privacy. Counselor access for individual concerns. Clear rules against teasing or harassment. This balances openness and comfort. Now, how does sex education affect a country's population health? Good sex education can improve public health. It can reduce teenage pregnancy, reduce STI transmission, reduce sexual violence, improve help seeking, improve menstrual health, improve gender respect, improve relationship skills, reduce shame, support healthier families, support future workforce participation, support women's education, support responsible fatherhood, support national health systems. This is why sex education is not only a personal issue, it is a national development issue. A country that educates young people responsibly invests in future families. Now, what makes sex education fail? It fails when it is too late. If students learn only after they are already exposed to pressure, the education comes late. It fails when it is fear-based. Fear alone does not create wisdom. It fails when it is abstinence only without practical health knowledge. Some young people will delay, which is good. But those who do not delay still need protection. It fails when teachers are embarrassed. It fails when parents are excluded. It fails when boys are ignored. It fails when girls are blamed. It fails when culture prevents honest questions. It fails when the internet teaches faster than the school. Now, what is the ideal model? Start early with body safety. Before puberty, teach respect and privacy. During puberty, teach body changes and emotional maturity. In adolescence, teach relationships, consent, health risks, pregnancy prevention, STI prevention, contraception facts, digital safety, and responsible decision-making. Keep the language age-appropriate. Keep it medically accurate. Keep it culturally respectful. Keep parents informed. Train teachers. Create safe question systems. Evaluate outcomes. Update curriculum for modern risks. And always remember, the goal is not early sexual behavior. The goal is delayed, informed, respectful, healthy, responsible adulthood. Now, let us address the biggest fear directly. Does sex education destroy innocence? No. Bad information can harm innocence. Online pornography can harm innocence. Abuse can harm innocence. Shame can harm innocence. Silence can harm innocence. But calm, age-appropriate body safety does not harm innocence. It protects it. A child who knows boundaries is safer. A girl who understands puberty is less afraid. A boy who understands respect is less likely to harm. A teenager who understands consequences is better prepared to delay and choose wisely. A society that educates is not corrupting children. It is protecting them from corruption. Now, here is today's deeper lesson. Sex education is not really about sex alone. It is about dignity, health, responsibility, consent, safety, relationships, communication, self-respect, future marriage, public health, and the ability to make wise decisions in a world full of pressure. If schools do not teach this, the internet will. If parents do not speak, strangers will. If teachers avoid the topic, misinformation will fill the silence. Children do not need vulgarity. They need clarity. They do not need shame. They need guidance. They do not need fear. They need wisdom. They do not need adult content. They need age-appropriate protection. The best sex education does not push children into adulthood. It helps them enter adulthood safely, slowly, responsibly, and with dignity. Thank you for watching Ask the Life and Intimacy Guru. If this episode helped you understand why sex education matters for boys, girls, schools, parents, health, relationships, and society, share it with a parent, teacher, school leader, or policymaker. And remember, silence is not protection. Shame is not education. Fear is not guidance. The right education, at the right age, from the right people, can protect a child for life. This video is for educational and relationship awareness purposes only. It is not medical advice, legal advice, therapy, diagnosis, or professional counseling. School sexuality education should always be age-appropriate, culturally sensitive, medically accurate, and delivered by trained professionals in partnership with parents, teachers, counselors, and healthcare experts. 1. https://www.nt. Newsroom fact sheets detail comprehensive sexuality education. UTM_source =ChatGPT.com. Comprehensive sexuality education 2. https://healthy-youth/what-works-in-schools/sexual-health-education.html. UTM_source =ChatGPT.com. Sexual health education, adolescent and school health 3. https://unesco.org/en/health-education/CSE ? UTM_source =ChatGPT.com. Comprehensive sexuality education.